Hello, today I'm going to be talking about hyperthyroidism and understanding an overactive thyroid. The thyroid gland is one of the most important glands. It's a butterfly-shaped gland in the front of your neck. It produces hormones to control the way your body uses energy. These hormones affect your weight, heart rate, bones, and muscles. They also affect breathing, digestion, and brain development. Some symptoms are weight loss, hand tremors, tachycardia, irregular heartbeat, muscle weakness, restlessness, and complications in pregnancy, like preeclampsia, preterm birth, and low birth weight. Common causes of hyperthyroidism are having a family history of thyroid disease, thyroid nodules, benign growths that cause the gland to overproduce hormones, thyroiditis, inflammation in the thyroid, and Graves' disease, a common autoimmune disorder that attacks your thyroid gland. These are examples of ways a doctor will diagnose a patient. Blood tests to detect high levels of thyroid-stimulating hormone release. They'll test antibodies for thyroid-stimulating immunoglobulins. They'll check for an enlarged thyroid gland in your neck. They'll do an ultrasound for detecting lumps or nodules, or radioactive iodine uptake to see how much the thyroid gland absorbs and distributes the iodine. Some treatments consist of a thyroidectomy, which is surgery to remove all or most of the gland, radioactive iodine treatments, which destroy overactive thyroid cells, and thionamides, an antithyroid drug to block thyroid gland hormones. In the next few slides, I'm going to be talking about the SOAP method, which are ways a doctor will diagnose a patient. In this scenario, the patient is a 30-year-old female. Her chief complaint is weight loss, fast heartbeat, weakness. She has a recent history of difficulty sleeping. Her family medical history consists of her mom having hyperthyroidism, and currently the patient is in her first trimester of pregnancy. Some of the patient's vital signs is she has a normal temperature, her heart rate is elevated, meaning she's tachycardic. She has an elevated systolic and a lowered diastolic blood pressure. Her breathing is in short intervals. She is in a lower weight class for pregnancy, and in her physical exam, her thyroid gland is visibly enlarged. Her blood work showed normal levels of thyroid antibodies, meaning that it is not Graves' disease, and her fetal monitoring was normal. Her primary diagnosis is her elevated heart rate, her elevated systolic blood pressure, her decreased diastolic blood pressure, and we'll do an ultrasound of the thyroid for nodules. The ultrasound detected small nodules resulting in hyperthyroidism. The patient's plan is to take propylthiouracil, which is a thionamide, 100 milligrams a day in 3 divided doses. She will be referred to an endocrinologist and obstetrician for monitoring. Two of my main questions for this research project was what causes hyperthyroidism and how to treat a pregnant patient with hyperthyroidism. I chose this question because I wanted a real-world situation where it wasn't just a regular person, and I wanted to find out what would be the best course of action for someone who is pregnant with this disease. In clinical diagnostic methods, they have shown that a pregnant patient with hyperthyroidism would recommend to take antithyroid drugs at the lowest dose for the safest option. By taking antithyroid drugs, it's safer compared to a thyroidectomy and radioactive iodine, which can increase complications in pregnancy. My AI resources were generally reliable, gathering information from sources that I used outside of AI, like American Academy Family Physicians and National Institutes of Health. I used Google AI and Gemini to ask research questions and define my slide content. I used Gemini to structure and organize this presentation, and all the information I gathered was cross-referenced against reliable websites for accuracy. Some of my sources was Google AI. This is the source link for American Family Healthcare, and then my CWI one was also American Family Physicians. And then I also have my AI summarized dialogue. Thank you so much. Let me know what you think and if you have any other questions about hyperthyroidism.